Did you know that an alarming number of people are using diabetes drugs for weight loss? It's a shocking reality we are living in, where medications designed to treat serious health conditions are being repurposed for cosmetic gains. The misuse of drugs like Ozempic and Wegovy, originally developed to treat type 2 diabetes, has skyrocketed in recent years. Some statistics might help to highlight the magnitude of this issue. Just consider the pharmaceutical giant Novo Nordisk, the maker of these drugs. Their market value has been competing with that of the luxury conglomerate LVMH, largely driven by the surge in popularity of these weight loss drugs. In fact, in the first half of 2023 alone, the sale of GLP-1 products, the category these drugs fall into, brought in a staggering $5 billion in North America. However, beneath the surface of this booming business lies a concerning trend. A study by the University of British Columbia found that people without diabetes taking these drugs had a higher risk of pancreatitis, obstructed bowels, and gastroparesis compared to those taking other weight loss drugs. With this rising trend, it's crucial to understand the dangers and side effects associated with such practices. Two of the most popular drugs used for this purpose are Ozempic and Wegovy. Let's dive into their story. Originally, these drugs were developed with the intention to manage type 2 diabetes. They belong to a class of drugs known as GLP-1 agonists, designed to regulate blood sugar levels. But soon, they garnered attention for a different reason: weight loss. The manufacturer, Novo Nordisk, experienced a surge in the popularity of these drugs. As of the first half of 2023, the company made around $5 billion from the sale of GLP-1 products in North America alone. This propelled Novo Nordisk to the top, trading places with LVMH for the title of Europe's most valuable firm. In the midst of this success, the company faced criticism. Some US insurers stopped covering the cost of Wegovy, leaving patients with high bills. Despite the controversy, the popularity of these drugs didn't wane. They continued to gain traction, not only among those who needed them for medical reasons but also among those seeking weight loss solutions. A number of celebrities have openly admitted to using these drugs for weight loss. Their endorsements, coupled with the hype on social media platforms like TikTok, have amplified the reach of these drugs. Health clinics are actively promoting semaglutide-based drugs like Wegovy and Ozempic on TikTok, capitalizing on the platform's popularity to attract potential patients. This has led to an influx of patients, further boosting the demand for these drugs. However, amidst the hype and popularity, there's a darker side to this story. These drugs, while effective for their intended purpose, can have serious side effects when used improperly. Stay tuned to learn more about the potential dangers and side effects of using diabetes drugs like Ozempic and Wegovy for weight loss. So, what are these dangers and side effects we're talking about? Well, several studies and user testimonials reveal a concerning array of health risks associated with the misuse of these drugs. Originally designed to treat diabetes, drugs like Ozempic and Wegovy have been repurposed for weight loss. But with this new use comes new risks. One of the most common side effects is gastrointestinal discomfort. Users have reported symptoms like nausea, vomiting, diarrhea, and constipation. But it doesn't stop there. Some individuals have experienced more severe complications such as pancreatitis and obstructions in their digestive system. A study by the University of British Columbia highlighted these risks, finding that people without diabetes taking these drugs had a higher risk of pancreatitis, obstructed bowels, and gastroparesis compared to those taking other weight loss drugs. While the absolute risk of these side effects is small, the increasing number of people taking these drugs for weight loss means that the numbers could become significant. Remember, these drugs were created to manage diabetes, not to aid weight loss. The benefits of these drugs for people with diabetes may outweigh the risks, but for those without diabetes, the risks may outweigh the benefits. Before you consider using any medication for purposes other than what it's intended for, remember this. Medications are developed with a specific purpose and demographic in mind. They undergo rigorous testing and trials to ensure their safety and efficacy for the intended use. So, when you veer off the recommended path, you're stepping into uncharted territory. It's essential to consult with your healthcare provider before starting any new medication, even if it's been approved for other uses. Remember, everyone's body is unique, and how one person reacts to a medication can be vastly different from another. The dangers of self-diagnosing and self-medicating are real, and can lead to unforeseen complications, including serious health risks. For instance, using GLP-1 agonist drugs, originally designed for diabetes, for weight loss, may expose you to gastrointestinal side effects like pancreatitis and digestive system obstructions. Your health is precious. Don't gamble it away for quick fixes. Always consult with your healthcare provider first.